Good morning. Welcome to the monthly GHA GDDS user group. Thank you for taking time out of your morning this holiday week to join us. We have Bill Wiley, our Senior Vice President of Business Operations, and Sharifa Navos, our Data Integrity Specialist, with us on the line. So can everyone hear me okay? This is Leslie Stanovich. And you can, I'm going to unmute all the lines currently so that if you have a question, now you are all unmuted. Everyone hear me okay?
Even employee help, I didn't have case reviews. It was all
yes.
module.
Again, we're trying to keep everything in one house.
Right.
Unless you can review it and
do keep in mind if your phone is not muted that we can hear background conversations, or if you put us on hold, we'll be able to hear background music. So I'll try to keep an eye on that and mute anyone who's coming through with on the line with background noise. But do feel free to chime in with any questions or comments you have as we go through today's call. Today's call and the presentation are being recorded and will be posted on the Data Services website probably after the holiday. So you can always pass that along to others who may or may not have been able to join this call. So we will get started. Our agenda today is fairly short. We want to talk about the 2018 data submission review and the closure that will be happening later this month so that we can finalize the 2018 data. We'll review the 2019 data submission schedule. We'll review the readmission module. I want to continue to bring that to everyone's attention because it is a wonderful resource that not everyone has taken advantage of to date. So I want to keep that fresh on the forefront of your mind so that you can notify your quality staff that that is a tool that is available to them, but we do have to go through the proper authorization to make sure people have the correct access for that. And then as always, we'll do any demonstration or that you might want to have on the visualization tool and get any questions, take any questions or feedback you may have. With that, we'll get started. I do, because we always have new users, like to just give a quick overview of what this call is about. And our Georgia Discharge Data System is required by the state of Georgia for hospitals in Georgia to submit their data. We are the vendor for that data submission. We partner with a subsidiary of the Missouri Hospital Association, HIDE, who is our vendor for taking in that data. You upload that data to HIDE.net on their web platform. That data is run through a lot of data checks. Some data elements are added to the data set, such as geographical codes, DRGs, patient type. So that data is run through a lot of different algorithms and assigned different variables. It then becomes the Georgia Discharge Data Set or Data System. GHA then distributes that or submits that data on your behalf to the Brain and Spinal Trust Fund Commission, to the state of Georgia, to the Agency for Healthcare and Research and Quality, AHRQ, and we also participate in the Healthcare Cost and Utilization Project, which supports research efforts nationwide. This is our schedule. Sharifa, do you want to mention anything about our schedule?
Hello, can you hear me?
I can hear you now.
Morning. Yeah, for the schedule, for some reason, Leslie, too, I'm not seeing your presentation, but you know, I kind of know what to talk about. I don't know if I'm using the wrong screen, but for the schedule, we're getting closer to closing the 2018 database, and that'll be due. Any type of correction or resubmission that you need to do for 2018 is due July 15th, then, you know, we'll be closing the database for good. So you'll get some emails from me regarding certain errors or any type of issues that you may have with your data. So I'll be reviewing that. I'm finishing up reviewing that, and you know, hopefully we won't have too many problems, and that'll help us for any future submissions so that you know, where your volume or distribution issues are, and you can, oh, here you go. I can see it now.
And you shared it earlier, but it must have
it
somehow
didn't
gone
come
away.
through.
We're still getting used to this new Zoom meeting functionality, so I apologize for that.
Yeah, that's okay. Thank you for that, though. Yeah, so as you can see, I think when was that? 2 weeks ago, April data was due on June 15th, so thank you for submitting on time. And on the 15th, so there'll be May 2019 data due, and then of course the 2018 database closure. So you'll get some emails from me before that date so that you're aware and reminded of those deadlines. And then as we continue with 2019, you know, we have a 45-day turnaround, so you have a month and 2 weeks to submit your data for the previous month. And, you know, most people have been submitted on time, and if there are any issues with your submission, usually I'll email you and let you know. And we recommend that you look at your status and the generated reports after you submit to make sure that all your numbers and all your data is included.
So Teresa, why don't you go on over the verification report as we're reviewing the 2018 data so that we can remind everyone the best way to review their data and make sure that it's complete.
Yeah, and like I was saying, it's always good to review your data after you submit it. And I know a lot of the data uploaders, you know, just are either in the IT department or don't really look at the data, they just submit it. But what we want to make sure, and you can just glance at the numbers, there's a verification report under the report section on the HeidiNet website. So people who have access to that, you'll recognize that image. So when you click on the report section, every time you submit a new data file, a new verification report is generated. And that verification report is useful, especially the first 5 pages, because you can glance at your numbers overall for each month, each quarter. And I have an example down here where I'm showing you that, you know, as you glance, you can see that November and December 2018, you know, don't have any data or have very low volume. And so when you see that, then you can, you know, go back to the file and see if it was loaded properly, or, you know, contact us. And as you're, because we're here to help you, and we can definitely tell you what's going on and how you can fix that. And then partnering with your, you know, different departments in your facility too, to make sure that this data is correct. So that's the first page. If you can go to the next slide. And like I said, up to page 5, you'll have these types of distributions shown. So you want to scan for missing data month by month, look for volume fluctuations, review your internal system to make sure, you know, you're addressing the issue. And then I would suggest always contacting your vendor, so whether it be Cerner or Meditech or Epic or CPSI, usually they'll be able, if there's an issue with the data coming through or the file being, you know, the correct extract or anything like that, they'll be able to help you. And of course, like I was saying, partnering with your, you know, different IT billing or medical record departments to make sure that things were put in the chart correctly and the records are there. So you'll see just by scanning the different data trends, and then you can just scan through and see, okay, everything looks good. Like this example, there's missing data for November and December. So when you see that, then you would see, okay, well, I need to go back and resubmit those 2 months, you know, because the data is missing, or if the numbers were much, much lower, just investigate a little bit further. And so this is a very good tool to use to make sure that your data is valid and clean, and also to make sure that the trends, whether they be you know, if they're bad, don't continue until the next year. And if they're good, then you can kind of have an idea of what your numbers look like. And this is for inpatient and outpatient. And of course, you can always contact us for any help that you need.
And we do request that you contact us directly, and we'll work with Heidi. It's better if you contact us and let us contact Heidi for any special requests. I know sometimes we've had Kevin Stock at Heidi run a specific data file for your review, but we would request that all those come through Sharifa or myself.
Yeah. So any questions about this verification report? We highly recommend that it be, and I'll be, you know, sending emails and pushing that so that you know to look at that as soon as you submit your data, and you get that email saying that it's been in there, the report is generated. So we highly recommend that you just open it and scan it, look at it, just to avoid any major resubmission. So any questions?
And we emphasize.
Oh, sorry.
That's okay. We emphasize that you know who is submitting your data. I had a question from somebody on the call wanting to know who is submitting your data. So if you don't know who is submitting your data, reach out to us and we'll be glad to let you know that. So one, you need to know who is submitting your data, and two, who is reviewing the data reports, because it may or may not be the same person. I know in some of the larger facilities, the IT department submits the data file, but they're not necessarily the appropriate staff to review the data reports. So, you know, we can help you identify who is submitting the data, and then you can work with internally with your team to review data reports. Any questions or comments about the data submission and edit and verification reports?
Yeah, hi, this is Mike from Augusta. Are we doing anything with 2017 at this point, or is that closed out and gone?
Thanks, Mike. No, that is closed out, and that's what we're working on currently for 2018, because once we close the database at the end of July and it is released in August, that will be the final release of 2018. That's why Sharif is working diligently to review all the data, identify any anomalies or missing data months for hospitals, so that this is the opportunity to get all of that data in July, so that 2018 can be as accurate and complete as possible.
Because the issues that got flagged for us in the first quarter of 18, we had the entire year of 17. So whatever was going on has been wrong for like 15 months. And then in April 2018, something changed, and I'm told the extract program hasn't changed. So I might need some help to understand what caused the spike in numbers for us.
Absolutely. I'm taking a note down, and we'll be glad to have a call with you and work through that. Any other questions, comments? We'll move forward. Just wanted to remind you of the resources that are available to you on the GHA website. This is just a quick screenshot of that you have available that are static reports. They're generated from Haney's, the Hospital Association of New York State. Partner with them and their subsidiary DataGen. They produce modeling reports, cost modeling reports, and wage index. So have there been any recent reports published since our last call?
I think the quality trend, we measure trends from Q1.
I mean, that hadn't changed. She's still got to pay.
So those reports are on the GHA website under the member.
Let the video come back and let's figure out.
And everyone should have access to those. If you do not, please give myself or Sharifa a call, and we'll be happy to work on that. Also, under data services resources, there are links to different forms, authorization forms. There are the link to the YouTube channel where the recordings of the user groups are. So there's a lot of resources available there. Another screenshot of some of those resources. Now, we just wanted to talk briefly about the visualization tool. That's a screenshot. Wanted to get any feedback you may have. We're still working with JVN to get the 2019 data. The first quarter published should be when everyone returns from the holiday. That data should be published, but we're also still working with them to enhance some of the features here. You know, I just wanted to take this opportunity to find out how you're using the tool. If you have any questions, if you have any suggestions for the visualization tool. So I'm going to pause, and I'm going to give it a long pause, so somebody speak up, please.
Leslie, this is Lisa from Northeast Georgia. I have always had trouble even logging in, and anytime I've tried to reset passwords, I've never gotten emails or any contact on how to even log in. Is there anything we can do to get a better response from them?
Sure, absolutely.
We do have a lot that the email comes from support@jvion.com. We have found a lot of that the times that it's going to folks' spam and junk folders, so it's getting caught in the hospital systems because it's automatically generated. But we'll see if there's something that we can look at for that.
Okay, because I've checked my spam, I have checked all of that, and I haven't seen anything come over.
Okay.
Absolutely, we'll get right on that, Lisa. Thank you.
Thank you.
Hey, Leslie, this is Allison calling from St. Joseph's Candler in Savannah.
Hi, Allison.
Hi. I do not like this tool at all, just because our CEO wants us to drill down into like MSDRGs and then, you know, just get to this just really detailed information. And I'm not seeing it in this tool. Maybe it's just me, but we like to look at actually zip codes and as well as the counties, the attending physician. We also like to see operating physician, but I know that's not available. But yeah, I'm just having some trouble getting through this tool.
Thank you for that feedback. We are working on adding an additional tab that is a filter page where it has many more of those options that you can select and will allow you to drill through and make your own selection. So we're hoping to have that very soon, and that will meet your need. But Allison, I would welcome the opportunity to maybe you know, talk with you one-on-one on your specific data requests so that we can see how we can have the tool support that.
Okay, sure. Thanks.
Thank you. Other comments, feedback, and questions?
This is Allison again. I have another comment. I spoke with Sharifa, I think it was last week. I have a new analyst working with me, and I tried, you know, he has access to JVion and was not able to pull the data at the detail that we're used to pulling it through the Analytic Advantage site. And I was told that you're no longer giving access to that site. So it actually has created more work for me because I have to go in to pull the data, whereas he only has access to this Tableau visualization tool. So that was kind of a problem with us.
Right, we have been running parallel systems now, but we've been phasing out users on Analytic Advantage, and we are not adding new users, but we can work with you to get the specific data request filled that you need.
Okay, and I understand that's something that I would have to communicate to you guys to run for us. Is that right?
Yes.
Yeah, that might be a problem because there's like time restraints, and you know, that just makes me hesitant because what's expected from my department, and I have to tell them I have to wait for y'all to run the report. I understand, but that's just an obstacle for us.
Yeah, we were just having some real issues with the Analytic Advantage tool, and honestly, the amount of data that was being able to be pulled, and we had a legal opinion that was kind of running afoul of some of the HIPAA minimally necessary requirements. So we've had to restrict access to that.
What we found is that we were having, as Bill mentioned, that the Analytic Advantage tool was really just too open and had too much flexibility in the level of data that could be accessed online by consultants and by hospitals, individuals. Good, they turned it off. But in doing so, we realized that the visualization tool may not meet everyone's needs. So we're trying to enhance the visualization tool so that it will meet your needs. And in the meantime, we here at GHA and the Data Services Department want to kind of bridge that gap to meet your specific needs for those who rely, we're heavily reliant on the Analytic Advantage tool. In addition, and I meant to say this at the beginning of the call, is that we did send out an email blast, I guess a few weeks ago, regarding the release or the release of the order form for the 2019 limited data set. Many of, especially of the larger facilities who have a data department and the appropriate platform to house such a data, the limited data set is a de-identified patient level data set of the entire state. That is a subscription. It is not required as additional fee for the inpatient and outpatient data. So I wanted to just mention that, that many facilities find having that flexibility to work with the larger data set useful. So that being said, that's always an option for folks as well. But we certainly want to, we do not want to hinder your facility or department in running analytics that you need for your operations. So Allison, we'll circle back around with you to see how we can meet your current immediate need and then work towards getting the visualization tool to where it functions the way you need it to.
It'd be helpful too to learn what data elements you're routinely pulling, and we can make sure that when we're able to launch that first tab on the visualization tool, that it'll have those elements on there that you can use to filter.
Yeah, that'd be great. I mean, with so many functions moving from inpatient to the outpatient setting, our CEO likes to look at down to like CPT levels, and I understand like the outpatient side is you're going to get duplicate records, so that's kind of a challenge too. But yeah, that'd be great. I'm happy to work with you guys.
We'd love the feedback.
Yeah, we really would.
Because we have to do tools based on kind of the 80-20 rule, and then we want to build on that for the high specialty 20% that need this as a different level.
This is Mike from Augusta. I'm just wondering, would you have a data dictionary of what all is on the file that's available for purchase?
I do. I will be glad to send that to you.
Thank you.
Yeah, we have a data schema for the limited data set, and it comes with lookup tables. There are crosswalk tables that define the patient type, the admit type, those kinds of things. So I'd be glad to send that to anybody that would like that. We may have it posted on under our documents, but if we don't, I'll be glad to send that to whoever would like that. It's an Excel file, so it's just the layout of the data schema. And you know, again, to reiterate, the limited data set by the end of the year is, you know, well over 1 million records. So you have to have the appropriate platform and bandwidth to, you know, house such a data set. And that data is released quarterly on a rolling quarter basis. So you actually get 5 data releases of the limited data set, you know, every year. Any other thoughts or feedback on the visualization tool? Well, it's not okay.
The limited, the order form, the customer.
Right, the order form for the 2019 limited data set is on the website, but I don't have the data schema posted. We can post it there, but I'll also be glad to send it to those who are interested. If you want to message me in the chat box, that would be fine as well. So moving on to our other tool, the readmission tool, I wanted to just remind you that this tool is available you would be able to see readmission data only for your hospital, but we do have to have CEO authorization first for the CEO to identify the appropriate staff to have access to the tool, and then that staff would need to sign an authorization form. There is no additional charge for this. The State Office of Rural Health initiated a grant for us to develop this tool, and it is, you know, very helpful. Our quality staff down in GHA are using this tool to work with hospitals to identify areas where they can improve. As you can see, I'm not going to drill down into anything. This is the state, and this is the live website. But you know, we have the option to look at different conditions, the AMI, COPD, heart failure, hip and knee replacement, pneumonia, and sepsis. And I do want to emphasize that this tool is not the CMS methodology, which takes into account some restrictions and exclusions. This is simply you know, did a patient come to my hospital and were they readmitted either at my hospital or somewhere else within 30 days? And so it's just to identify areas where you may want to improve. It is not designed to align with the penalty model that CMS has. It's strictly just a quality kind of improvement, care improvement tool to help you focus in on those areas. Go ahead, Bill.
I was going to say, and one of the reasons that we allowed a lot of drill down into this, and we won't show it, but you could actually get to your hospital's medical record, which is why we have so many of the access forms. Since we're not making any judgments on whether that was a planned or unplanned readmission, we thought it was very important for the hospitals that are in this to be able to get down to that actual record to go, oh, I know this person and I knew they were expected to come back within X number of days. That was part of their care plan. So this does have the ability, I mean, it'll tell you it's medical record number, discharge date, all of that. So we're definitely not going to click on those buttons here, but at your facility, you will be able to drill down to the individual patient to figure out who is making up that percentage for you.
And there are different tabs that you know, stratify and visualize. Thank you. Goodness. You know, there's a mapping feature. You can look by city, by payer. I'm not going to go to the physician tab because it actually lists the physicians. You would have access to, you know, those physicians that are at your hospital, and there is a trending that also shows some trending by physician. So I just want to keep, you know, bringing this to your attention that you may not be the person that would use this tool, but someone in your facility should have access to it. We want everyone to get on board with using this tool that is no additional, you know, cost for you. And those authorization forms are on the GHA Data Services website. Any questions?
This is Mike from Augusta again. I wanted to ask, is there a way to know if folks in our facility are using the tool?
Yes, I can look and send you an email, Mike.
I will say one thing about the physicians. We do have the physicians on there, but remember that's the physicians that are on the UB. So for the hospitals that use this tool, just be mindful that some of those are hospitalists that may or may not have, you know, that continuing responsibility. Some of them may be ED docs that saw them and they're still listed on the UB. So that's just a little context to put in the back of your mind when you're using the tool.
Other questions, comments, thoughts? Well, we know that it's the day before a holiday and we don't want to take up any more of your time. Hope everyone has some fun plans for the 4th. Our next meeting is scheduled for August the 7th, and hopefully we'll have some updates and enhancements to share with you and demonstrate on the visualization tool. And those of you who have made comments, we really appreciate your feedback, and you know, we'll be reaching back out to you individually to get more information about how the tool can be helpful for you. That being said, everyone have a safe and happy 4th of July, and we'll look forward to speaking with you soon. Thank you.